All right, thank you for staying with the Monday Report. Let's start that discussion on healthcare. Should some of the services be reverted back to the national government? That is a conversation we're having because we know now that 14 days ago, there was a meeting between union officials and the president, and they agreed that certain functions should be reverted. The governors, on the other hand, say that there is no such thing that should happen because, according to them, they can handle healthcare services just fine. And joining me in studio now is Honorable Eddy Oketch, Senator for Migori, and Dr. Davji Atela, KMPDU Secretary General. But before that, we asked you a question, should it be reverted? Let's see what you're saying online. A lot of feedback coming through. Let's try and squeeze them in first before we start this discussion. Trevor Mbija at Citizen TV Kenya used the hashtag Monday Report. So, Brian Chemwa says management of health services can vary across counties depending on their political, social and cultural context. However, centralization of health services under national government offers advantages in terms of public health protection and policy coordination. Okay. See what else you're saying. Ras Bashir says health being a critically very fundamental sector, only the national government is able to put it back on the right track to serve wananchi, just as is education and security. Okay? See what else you're saying here. Kiplimo Timothy says majority of health facilities across counties are in deplorable state. If reverting health back to national government will make it flourish, so be it. Kenyans should not suffer as this pull and push continues. Biwaruku says the fourth schedule, that's the Constitution of Kenya 2010, already distributed functions between national and county governments. What is lacking is the spirit of constitutionalism. An objective costing of the functions and allocation of funds to follow functions is lacking. Okay? Charlie says devolution, which is ugatuzi, is under siege, from starving the devolved units of funds to meeting medics with the sole aim of reverting functions to Afya House. Read Mafia House. Okay. Chasia MJ says big no. National government has all reasons to help county governments to have the sector work. Otherwise, what's the purpose of Ministry of Health if it's not to help ensure services is given to taxpayers? Kipkiru Ingeno says I will be the most happiest person if the national government will take back the health sector to its territory. Counties be willing to surrender the said services to the national government. Subject this to public participation, and every Kenyan will opt for national government. Okay. Dan Mugai says human resources should revert back to national government. Let counties manage infrastructure. But at the end of the day, it's a political will to make devolution work. All right, let's see. Let's take a last one here. Kemei Wiggle says we cannot rely on counties to continue relying healthcare services as there are too many loopholes the corrupt county cartels use to make themselves rich. I believe this will increase employment of health workers, closing up to the proposed ratio of doctors to the people by the WHO. All right, still a lot of feedback coming through. We'll read some of them in just a bit. But Davji, let's just start by clearing the air. There are reports that health unionists like yourselves met with the president and asked that the health functions be taken back to the national government. Is that the position, and why?
We've actually met with the president on 2 occasions. On the 14th of February at State House as all the unions in the country, and also on 1st of May, which is 3 weeks from today, at KCC during the Labor Day. And the issue of healthcare has always been core in the discussions. It has been iterated over time that they need to have an accessible health for all. And this has been agenda of the president that every Kenyan need to access healthcare regardless of their socioeconomic status. And then we have, as a union, have iterated and we keep on saying, with the state of healthcare that we have in the counties, that we say continuously that is highly deplorable, it is impossible for Kenyans to access healthcare with the state of the devolved functions. We must look at the mechanisms that will make the country invest in healthcare in the same mannerisms that they do with the security, they do with education, that will ensure that if you go to the hospital, you just don't go to a building that has been erected, you go to get services. And that's why, and I believe it's in the heart of the manifesto of this particular government. It was there as part of the BBI, and Kenyans have resoundingly been saying that there's need to have a change in the healthcare so that they can be able to access it.
So what more services do you want reverted back to the national government?
You know, Trevor, when you look at the Constitution in itself, I feel there was a misinterpretation of the Constitution. And actually, there was a misinterpretation, not that way, not I feel. Because it is very clear in the Constitution that the functions of the national and the county government are put clearly. where the functions of the national is the national referral facilities and the policy. Tell me, all the level 5 hospitals in this country, for example, Rift Valley Provincial Hospital, it doesn't serve only the residents of Nakuru. It serves all those counties around there. If you go to Coast General Hospitals, it serves all the counties around there. If you go to Jaramogi Oginga Odinga, it doesn't only serve residents of Kisumu. It serves all those counties around that place. So it actually fits the aspect of the national referral status, because you will not limit to who is being referred there. But in the aspect of the devolution, the RUST process, this was banked to the counties, which is, at the moment, most counties are struggling with it because they can't manage, they can't employ, they can't buy the drugs, they can't make services be delivered to the people. And that's why, to start with it, we need to correct the wrongs that have been there in the implementation of the Constitution. And then now we look at it. What level of functions can the county handle? Can they handle level 3, 2, and 1, which is now the promotive aspect of healthcare, so that the curative component, which is the most expensive, is given to the national, and so that Kenyans can access healthcare.
So as union officials, you have absolutely no faith in the devolved units to handle healthcare?
It's not a matter of our faith. It's a matter of reality. I may have a faith in any of these facilities that I walk in and die there because I cannot get the drugs that I need in emergency services. I may have faith and I go to that facility, and because there are no doctors, the way it's happening in most of these hospitals, I don't get the services. So therefore, what is needed there is actually functionality of these hospitals. Trevor, from devolution to here, we've been 10 years. And in these 10 years, for the first time, this country has over 4,000 unemployed doctors. It's for the first time we have the interns who graduate and stay at home for over 1 year. It is the first time we have interns who have worked for 9 months and the salaries have not been paid. This happens because of, I believe, a clear-cut dysfunctionality in the healthcare in the country. But if we have a well-organized, ring-fenced healthcare where the funds are there for every budget aspect, they won't have all that situation. So today, and we've seen this, there are a lot of negligence cases that are being reported to the KMPDC and to all other places. We even saw some in the Senate. But when you go down to investigate what is the issue, you realize that the doctor who is there to offer that service is not supported by that particular hospital. Number one, you realize that there are no emergency drugs for that doctor. Even if he sacrifices himself, he can't help that patient. You realize there are no equipment. So the negligence, almost 80 to 90% of them is on behalf of the governance and the counties because they can't support the system. Yeah. And that's why we are saying for people to get the service that they need, we need to be practical. The governors have to be honest. The county leaders have to be honest. You can ask any of the elected leaders, like my brother here, or the MPs, or the MCAs, or the city officers of the counties, how many of them actually seek care in those facilities? And I will tell you it is zero. But then they cling to manage it. How do you, as a person, bake bread in your house? And then when you want to eat, you go buy your neighbors. They all come to private facilities.
But they argue that funds follow functions. And the money is what they've not been given. That's the reason why running these health facilities has been a challenge.
It's a thought. And I keep on saying that because, you see, the fact that this thing was devolved in a wrong way and in a rushed fashion, you cannot say funds follow function. Because in the Constitution, Schedule 4, part of the county functions, it is very clear that the county facilities and pharmacies, the ambulances, are all within counties. So if the funds that are meant for that particular functions are there, so ideally, the functions of the referral facilities should not be within the counties, okay, so that the funds can be within the same way we budget for KNH. The same way the assembly budget for KNH, the budget for QTRH, and now also for MTRH, and for all the levels, for all the referral facilities, that's what actually should precede the level 5s in the country.
All right. Eddy, should these functions of healthcare be reverted to the national government?
Thank you, Trevor. And it's a wonderful conversation. I've been following my friend Atela for a number of times, Daktari. And I've wanted this kind of engagement because I think that there is a level of misunderstanding of how counties operate to the extent that counties are vilified for what they actually don't have control over. And it's an opportunity to actually be able to, especially, try to edify the professional communities such as the KMPDU to understand that the complexity that we are dealing with is a legal complexity, and therefore is a misnomer in the execution of that legal mandate that is given to different counties. First of all, when you talk about healthcare, as he has so well said, we have got two factions, more broadly, but you can again try to disintegrate it down. There's preventive healthcare, and then there's curative healthcare. If you look at the devolved functions under Article 6 of the Constitution, this article is talking about devolution and access to services. That is the title of the of that particular title of that article. Why is this critical? Because the conversation that KMPDU is having right now with the state in the name of the State House is a critical one. Because if you look at sub-article 2 of that article, it requires that we have this constant consultation and cooperation between national and the county government, which then tells me that whatever the State House is doing is a good one. But it's a good one only if we stick within the framework of devolution. Because the framework of devolution is a constitutional framework. And that constitutional framework brings about the issue of legality and legitimacy. Who has got the legal mandate by the Constitution to do some function with regard to healthcare, and who has got the legitimate function. Legitimate function is whereby you find a serious case of curative incidents, which then you ask yourself, should I take first aid on this? So for instance, if somebody is working today in World Vision, and they've got a critical illness, and they're working somewhere in the middle of Siaya, or in the middle of Mandera, and the next hospital they can get to, they've got, let's say, they've got a serious thing a serious condition that needs surgery, and then that means that they can only be taken to a national referral hospital, but immediately they need to be stabilized. And the only medical facility they can be able to access is a dispensary or a healthcare center. What do? Do you pass all these initial stages and take them right, try to fly them before stabilizing them? That's what I call legitimacy. But then the legal function is also very critical in terms of who does what. Constitutionally, under Schedule 4, the national government has got only two roles as far as healthcare services under Article 6 is concerned. One is the articulation, control, and management of national referral hospitals. Very clearly stated. I think it is Section 23 of that schedule. And then the second thing is managing the national healthcare policy. Then now, the county governments are given all the other powers, including the issue of managing primary health care. Primary health care is basically about consultations and seeking immediate advice when you are confronted by any healthcare issues. And why is this critical? And according to the framework of our Constitution, this was critical because if you go to every county today, Trevor, you will find that the issues of primary healthcare vary according to different counties. There are different causative factors that contribute to primary health care issues. For instance, if you go to the lakeside of Nyanza, somewhere like Homa Bay, and somewhere partly like Migori and Kisumu, you will find sometimes that there's a serious HIV prevalence cases in those places. Such that those cases, the way you want to deal with them, you want to deal with them in the context of Homa Bay County and engaging on sometimes a mix of medical advice and social advice that is best curated to that area. If you go to a place like Mandera, for instance, where sometimes families are so close because of the nature of cultural leanings, such as Islamic practices, maybe women are not as much engaged in practices that can cause HIV/AIDS, but for them, maternal health care become a very critical problem. That is why the framework of the Constitution saw that it is very well meant for every county to be able to take control of their primary health care visioning. Fair enough, but have the counties been able to take care of health care as a devolved function? That's the question. First of all, before we answer that, we go back to what you said, and I didn't want it to skip the mind of Atela, because Trevor talked about something that's very important, and I've been struggling with it because I'm a member of Finance and Budget Committee in Senate, and I'm also a member of the County Public Investments Committee, which are the two committees that are looking at the resources that are supposed to go to the counties. These devolved functions that are legally mandates of counties must be financed they must follow function. And it's not negotiable. Yeah. Because under Article 203 of the Constitution, that money is guaranteed that it must be given to counties. But what we have been seeing nationally is that the problem is the national government, which is the treasury, particularly, has got a pseudo tendency of actually prioritizing national functions over devolved functions, so that the portion of equitable resources that are supposed to go to counties delay as much. Today, the last 2 weeks, we have had a number of meetings. In fact, one I had to sit in a meeting together with my colleagues Atella up until 9 p.m. with the CS of Finance and try to agree with them to give counties money. And as I speak, he promised us that he's going to give counties money for February and March by the end of last week. Last week passed, counties have not received money. You can imagine the kind of pressure that this one brings. Now, if that pressure comes, Atella here will then blame counties for not doing their functions. Yeah. When in reality, the problem that has been is just an exchequer problem, where exchequer is trying to look at exchequer demands vis-a-vis exchequer requests, and then chooses to prioritize national exchequer requests. Yeah. The biggest problem is that the national government must prioritize giving money to counties that belongs to them and dues to them and not put them in these loans. And most importantly, is the schedule of that disbursement has been placed by Senate, and that must be observed by the National Treasury. In fact, I wanted to challenge him for more, you know, I like intellectual conversations because sometimes they tend to be objective. I wanted to challenge my friend Atella and other professional bodies to even envision not thinking about something like Health Risk Commission, but think about something as adventurous as making the Treasury of Kenya an independent institution, such that when it makes decisions about disbursement of resources, it can be able to look at national government and county governments as independent bodies which must give money in a more objective way.
So it is not beholden to the national government.
Exactly.
Okay, but Atella, is this a management problem or a financial problem?
You see, the reason why partly I agree with him, but partly I don't agree with him at all, is as we speak, the Treasury holds counties funds for just probably February and March and April. But the issue of dysfunctionality of the healthcare in the public facility is not new. It's something that has been there over we can say 10 years. When we went on strike in 2016, 2017, and we said, Lipa kama tender, we were actually referring to the payment of the MES equipment. We're referring to all these particular things that have been paid so quickly in the process. But then when it comes to healthcare, up to this point that we have only 3 months delay, counties have not employed healthcare workers, meaning the shortage in these facilities' existence. Governors are actually thinking to follow the steps of Professor Nyong'o, because Nyong'o is very honest, and he has seen that with this budget that I have in my county, and there's no any way to change it, I'm not going to run this particular facility. Many counties are thinking to have those hospitals commercialized and standalone, and that will actually make it not accessible to the public.
True.
So in reality, as much as we say that there's a capping of this cannot work. But then when we have the healthcare workers in the counties moved and centralized into like an health service commission, then what it means that the government has to budget independently for health workforce just the same way we do for other independent institutions, like judiciary, like police service commissions, like the teacher service commission. Then what does it mean for the counties? They now have a relief of that, and therefore they can actually employ. They will not be above the ceiling of the PFM Act, where they cannot actually supersede it. So that will actually make healthcare workers be there to offer services.
Yeah. Let's try and concretize what he's talking about.
Yes.
Because you can actually concretize this thing and then visualize it.
Yes.
And then come up with a deductive conversation.
Yeah.
When you talk about general funding of healthcare, then it doesn't really come home. Let's go bit by bit, and I think that there are 4 areas that you can actually be able to trace and see whether the national government has been able to actually empower health services in the counties. The first thing is facilities. Healthcare facilities start with, let's say, just say buildings.
Yes.
right? You build a dispensary here or there.
And for that, the counties have done well.
Yeah, the question is, have the money that have gone to the counties built a number of healthcare facilities? Because the main question here is taking primary healthcare function to national government. Because
so you both agree
that even
infrastructure is done well.
That infrastructure is very well done. And as a matter of fact, I've studied healthcare in the context of experiential learning, whereby when in my community, when my dad or my uncle is sick, how do they behave when they're sick? There's something that he will tell you is called placebo effect. Placebo effect is whereby by either counseling or putting in a certain environment alone, your mental state or your physical state as a health person gets better by just being in a facility other than home.
Yeah.
If you take our people away from their home today and just get them in something that has been built well, even without the other functions I'm going to go to, and then you say, you are in the hospital, my dad starts eating, he starts behaving well, that placebo effect has been there in the counties that has improved health. The second thing becomes, when they get there, who do they meet? That is called personnel, which is the healthcare workers, the doctors, the nurses. Yeah. That is where we have had a bigger problem, because there have not been serious employment. And even where counties have done a big job in terms of having people like community healthcare workers. There used to be a community healthcare volunteers where the people are reaching people. The national government has not been forthcoming in terms of helping. In fact, right now they're proposing that the county should introduce 2,500 contribution, and the national government introduces 2,500 contribution. Good idea, but why can't it just be housed by the counties? The third issue that has been there is that when you're diagnosed with any form of disease, can you be able to get medicine? Yeah. Okay? And it's sometimes a very simple medicine. It could just be a stabilizer or something just to make you kill pain. And medical issues have been a problem because those funds are not coming to the county. Then the fourth issue, which has been the issue that we have been fighting about in the Senate, is now the medical equipment, which is basically, can we have a sophistication that can be able to help these institutions that you have built, whether it's a dispensary or a healthcare, that if there's a complexity that we cannot be able to deal with just by simple diagnostics, can we be able then to take further steps, give you some x-rays or before even we refer you? Because remember, the referral function is still, the national referral function is still for the national government. Before we refer you, can we be able to do at least some basics? So in these four parameters, are you satisfied with what counties are? Yes, I'm coming to you. I want to give you statistical. That's why I say if you go concrete, we can be able to talk. The money for medical equipment has always been allocated, but the national government has refused to give it. I dealt with something called DORA, and I'm in finance committee. The medical equipment services money was mostly being managed by what we call MDAs. Okay? These ministerial departments and agencies. They refuse to give it to counties. What does that bring? Counties cannot plan. When you start drawing contracts for medical equipment and choosing for counties what they need, and you are managing at national levels, the counties cannot be able to prioritize. They cannot get value for money for these things. And most importantly, they can't monitor and evaluate the functionality of that particular contract. To the extent that even this DORA that we have just passed, that you saw, we were fighting with the Kenya Kwanza senators in Senate to pass that DORA. There was a pending bill of 5.6 billion that the national government accepted, the Treasury accepted that this money needs to be given to counties to manage it directly, but it was being managed by MDAs. And that has been the problem. The fact that you have devolved a function, you cannot understand the priorities of this medical equipment, you cannot structure contracts for these counties, yet you still want to be able to control the money. Now, what is the problem there? I can tell you for a fact, and without any kind of mischief, that is just pure greed. That people want to control the monies that counties are going to use on those, especially those two facets, drugs and medical equipment services, because of controlling tenders. Right now, he knows that the conversations that they are having with State House, he knows very well that already the ministry has already said that they want to go as low as tendering 90,000 kits for community healthcare workers. They even changed the name now to what we call health promoters. I mean, what is that if not tendering? Because explain to me how CS Susan wants to go to the village of Kabondo or to the village of somewhere in Elwak in Mandera to be able to dictate to them the functionalities and the kind of kits that CHVs should be able to work with. Give it to counties. They can manage it better.
All right. I'll come to you in just a minute. I have to take a quick break. And then this is an interesting conversation. Let's take that quick break and keep your views coming. Should these functions be turned to the national government? That is just a bit, all right? To stay with Monday Report.